So everyone, welcome to the ADPKD Registry Annual Report 2021 webinar. Before we get started, I want to highlight a couple of things. This webinar is being recorded and the recording will be available within the next week. As you are already aware, everyone is muted, but you will be able to submit questions to the Q&A box, and we will answer as many questions as possible during the Q&A session. Please note that we are unable to address any specific medical questions. Also, here is the activity disclaimer. Please note that the information presented in this webinar is for educational purposes only. It is highly encouraged that webinar attendees seek diagnosis, treatment, and advice regarding any medical conditions from your healthcare team. And now let's get started. Our presenter today is Elise Hoover. Elise is the Senior Director of Research at the PKD Foundation. She led the design and implementation of the ADPKD Registry along with members of the clinician, researcher, and patient community. Before joining PKDF, Elise worked as a clinical research coordinator at Tufts Medical Center on PKD studies such as Reprise, the tolvaptan clinical trials, as well as held an epidemiology fellowship at the National Cancer Institute. She's excited to be able to contribute to patient-centered research in her position at PKDF. And also, we want to make note that Elise has no relevant financial conflicts to disclose. So now I will hand it over to you, Elise.
Thank you, Malini. And hi, everyone. Thank you for joining us. Just waiting for, oh, there we go. All right. All right, are we all set, Malini?
Yes.
Perfect. Okay, great. Yeah, so we're here to show you what we're learning in the ADPKD registry. And you may have already seen some of this content in our 2021 annual report. If you haven't seen this yet, we will send it around after the webinar, and it's also available on our website. We're super proud of it. And so that report talks about the data in the registry from our second year. So what I'd like to talk about tonight is first why registries in general are important to research. Then I'll go through some of what we have in the annual report and what we're learning from the data. And then lastly, I'll talk about why this registry in particular is important for ADPKD. So this, of course, isn't a solo effort. There are many at the PKD Foundation who make this possible, but specifically I'd like to acknowledge the other members of our research team, Chris Visconi and Vanessa Holliday, and then our designer, Glenn McMillan. Okay, so why did the foundation decide to build a registry? So a registry is a collection of individuals with a given disease who provide data on their experience. And what I'd like to do is talk about how it compares to a clinical study, which is a classic research design that you might be more familiar with. So you are limited to sign up for a clinical trial based on inclusion criteria around the specifics of your disease. However, in a registry, there are a few limits to age or disease stage. Really anyone with a disease is invited to join. In a trial, there's a maximum number of participants, and ultimately the study will close for enrollment. But in a registry, if we can help it, the study never closes and participants can continue to sign up as long as they're interested in participating. Also, the kind of data you can collect in a study, in a clinical trial, are pre-selected based on the protocol. But in a registry, there's more flexibility in the questions, and we can continue to add new questions as we go. One really important similarity, though, is participant confidentiality. So both clinical studies and registries separate data from identifying factors like name or date of birth. And I'll talk more about how this works in our registry later. Okay, so there are also different kinds of registries. Traditionally, clinic-based registries pull data from your electronic health record. And the only point of contact for patients is when you sign the consent form. The data itself is also largely focused on tests and procedures from that specific hospital or clinic. However, patient-powered registries, as we call them, focus on PROs, or patient-reported outcomes. This data is provided directly by patients and often relies heavily on engagement with the registry. So that means not only signing up, but continuing to come back and answer more questions. They can also collect data that's very unique, such as quality of life, that you can't get from the health record. So in our history, we have been funders and supporters of research, and this is our first research project run by the foundation itself. It was launched almost 3 years ago on PKD Awareness Day, and it's hosted online. So we hope that our goals for the program will go far to help advance research and find better therapies and a cure while utilizing the patient voice. So far, we have over 2,400 people signed up for the registry, which is incredible. You know, and it isn't just about the data for us, it's about people plus data. So we're really proud to call this registry participant powered because we're collecting details of the patient journey directly from those with ADPKD. And we also try to be patient centered by inviting those with the disease to participate in our advisory groups, in our working groups that make new modules, and also to help us beta test as we put those modules into the platform. Right. I do want to highlight something unique and important, which is this idea of longitudinality. So understanding how the patient journey changes over time is key. And that's why we ask participants to fill out certain modules multiple times. For example, our core is every year. Some of our quality of life tools we ask 4 times a year, quarterly. Okay, so here is the important part before we get to the annual report data. I want to share the process with you about how we protect participant privacy and confidentiality. So patients access the registry using a secure web-based portal hosted by IQVIA, which is a company that this is what they do, is they protect participant data. The portal assigns everyone a unique ID and automatically removes personal information, and those identifiable details are stored in a secure and separate location. And then meanwhile, when you fill out a module about your disease experience, the answers are recorded by that unique ID, and then that de-identified data is stored in a secure location where we can share it with researchers based on the advice of our advisory panels. And I do want to say also that we didn't just make this up. It's based on established rules by the National Institute of Health and the FDA, and the entire program is reviewed annually by an institutional review board, just like a clinical study. Of course, if you have any questions about that, reach out to us. We take this very seriously, and we want you to trust us with your data. Okay, so now the good stuff. This is our annual report based on 2021 data. We'll create one of these every year to show you the impact of the data we're collecting. This is our second one. Our first one was last year. And you'll see a lot of charts and graphs, but what excites me most is the participant testimonials. And these highlight why the data is important to help describe the patient experience. These are pulled from answers to our modules where we say, hey, tell us more about this, or are you experiencing something different than is listed in these response options. So we get some really interesting details out of that, and we hope you enjoy them. Oops, sorry. Okay, so this is what our participants look like. They are from all over the US and are in many different stages of disease. We have over 3/4 who are still pre-transplant, their kidneys are still functioning. But as you can see, there is a need to increase both racial and gender diversity in the program. So that's one of our goals for 2022. And while we have over 2,400 people enrolled, less of those are considered engaged. So engaged means that they haven't just signed up, but they have logged in and filled out at least one of the modules. So the data in the rest of the presentation is from those engaged individuals. All right, here's some data from our ADPKD impact scale. This is a validated tool, which means that it was tested in the specific disease population and it's known to work in that population. So Otherwise, we would have to develop our own tools or use those developed for other diseases, which won't get us the same meaningful results that something developed in ADPKD patients could. And this is also an example of how valuable patient-reported data can be. It's really difficult to measure the impact of PKD on quality of life without asking patients directly. And here we see the emotional impact of PKD in the 2 weeks prior to filling out the module. And that's a 2-week recall period. So that's why we send this out 4 times a year to try to get some more points in time and understand how that looks for you over the year instead of just 1 2-week period. Okay, so this is our ADPKD pain and discomfort scale, and it was validated by the same researchers who created the impact scale from the last slide. So, we believe that knowing more about kidney pain will be important for informing clinicians about the symptoms that impact their patients' daily lives. So in this table, we separated out sharp pain in purple, dull pain in blue, and then fullness discomfort in green. And then we separated that data by CKD stage. So this is based off of kidney function that patients tell us about in the core questionnaire. We use that to understand what their chronic kidney disease stage would be. And what we learned is that while there are some differences here by stage, pain is a steady impact on many PKD patients regardless. So this is something really important. So we want to make sure we're talking to clinicians about. And also for anyone who's interested, Vanessa and I just got back from the NKF clinical meeting in Boston, which is a big collection of clinicians, and we had a poster talking about this. So we want to make sure that we're not only collecting this data, but we're putting it in front of clinicians so they can learn from it. Okay, this is data from our family history module. So genetics tells us that an affected parent has a 50% chance of passing on the ADPKD gene to each child. But there's still some questions about what this actually looks like in families. So what we did is we broke this down by the number of siblings. So for example, 45% of those with 2 siblings were the only one with ADPKD, and 20% of those families had all 3 siblings with the disease. So we're hoping that you'll think of your own sibling count and come in here and see where you might fall. Yeah, we just think it's really interesting to see how families are impacted by the disease. This module also collects data to help us understand how PKD progression may look different from that of your other family members, which is really important to understand as well. Okay, so there is limited research on what diets or supplements should be recommended for PKD patients. For most patients, clinicians recommend limiting salt in the diet. This helps lower blood pressure or slow progression. There's also recommendations to lower phosphorus or potassium as kidney function declines. But of course, we need more research to understand the impact of diet and supplements on disease progression and quality of life. And that's where the registry comes in. We get to see this data coming directly from patients and understand what they're doing now, and then look at their other data and see if there are any patterns. Okay, this slide, we look at data from our liver cyst module. So 34% reported diagnosis of polycystic liver disease, and then 73% said that they at least had cysts on their liver. So what we were interested in was those with such severe disease that they needed a liver resection. So 26 people reported having a liver resection. All of those were female, and most of them were told by their doctor their liver was larger than average. And when we looked at how that translated to symptoms and quality of life impacts in those 26, we heard a lot about feeling a full or bloated abdomen, pain in the rib cage, and abdominal pain. And so learning more about issues outside of the kidneys helps us educate providers on what a PKD care team should look like. We want to make sure patients have access to a specialist who can address issues that impact their quality of life. So here, it's not just about a nephrologist, but it's about a hepatologist or a liver specialist. Okay, so this is our data on intracranial or brain aneurysms. So an aneurysm is an outpouching in a blood vessel, which can leak or rupture. So research tells us that PKD patients have a 5 to 10% risk of developing a brain aneurysm, and that is 5 times the risk of a general population. There's also an increased risk if someone from your family experienced aneurysm in the past. So we found that 50% of participants who filled out the survey said they are being screened regularly for aneurysms. And the biggest reason from clinicians was family history. So gold star for clinicians, that's exactly what we want to see, is that attention to family history. Now let's look at an example of what we don't want to see in this data. So total kidney volume is an important measure to understand an individual's risk for rapid progression of disease. It's also used as an outcome in many clinical trials. So despite this, almost 70% of participants said they never had a total kidney volume measurement or they were unsure. And of those who reported getting a measurement, especially by CT or MRI, which is the preferred method, a large majority was for research purposes, not for prognosis, not for medication evaluation. So this is not what we want to see from clinicians. And what's exciting about having access to this data is that the foundation is already using this insight to create clinician-facing education about TKD. And we're also creating patient-facing education to help them advocate for better care when they go in to see their clinician. So it's really helpful for us to not only know from our conversations with clinicians, what patients should be getting in the clinic, but then to ask patients and say, is this the care that you are getting? And to see that discrepancy and then to help tailor education appropriately. Okay, this is our last slide from the annual report. So this is how we help recruit for research studies. And we've helped 9 so far. These are listed here, which is really great. So basically what happens is the core questionnaire tells us details of your disease that serve as inclusion criteria for studies, like kidney function, like age, current symptoms, whether you've had a transplant or are on dialysis. It is important to highlight that when we are looking at these groups of patients for studies, you are still just an anonymous ID. We are not looking at your name. We just love looking at the ID and what the data tells us about how many people might qualify. So we then create those groups of individuals by anonymous ID who we believe may qualify for a study. And then we'll ask the portal to send them an email that says, hey, you might qualify, here's why, and here's what participating looks like. And what's important to us here is that we leave the power in the patient's hands for whether they want to then reach out to the study team. And our goal is really to make research more accessible to those who are interested in signing up and maybe just aren't aware of all of the studies out there or don't know that there's one close to them. So we're hoping that this is not a nuisance and that people enjoy getting the information and hearing about the studies that are going on. All right, so that was great. That was interesting. At least I hope so. I found it interesting. But why is this program important to the greater PKD research environment? So these at the top in the blue boxes are challenges that we hear from researchers that we hope the registry can then address. So following a large variety of PKD patients over time can help understand how the disease progresses. Our nationwide centralized database means we can collect data on people from many different clinics and hospitals. And then the availability of this large amount of de-identified, harmonized data makes it easier for us to share that with researchers and inform new research questions. And then, of course, helping recruit for clinical studies accelerates the testing of new therapies. So in summary, joining a registry is one of the most impactful things you can do to open doors for more and better research, at least in my opinion. Okay, I know I already mentioned longitudinality, but I wanted to hone in on why this is important for the ADPKD registry. So we are collecting data beyond a single moment of time, and the goal is to look for patterns and changes as your disease progresses. So the core questionnaire not only helps us match individuals with clinical studies, but it also is eligible, has eligibility criteria for other modules. For example, the core asks if anyone has liver cysts or a diagnosis of polycystic liver disease, and only those who answer yes then receive that liver disease module. And then the impact scale can help us follow things like fatigue over time. And what's cool is that we can see if those trends also follow changes that you report in your core questionnaire, like kidney function changing, new symptoms. And then things, of course, like manifestations outside of the kidney can come up later in time, can be resolved, new events can happen. We want to make sure that we're not just focusing on the kidney, we understand the entire disease experience. And some of the feedback we've gotten from participants, which we always appreciate, is that sometimes it can be very repetitive, filling out the core every year, filling out the impact scale 4 times a year. It's a lot of the same questions. So we want to thank you in advance for doing that. It is really important that we have updated data on you, and we appreciate your patience. Okay, so I wanted to end by sharing some features of participation about the registry. So this is the participant dashboard. Once you log in to the registry, on the side menu, you go to dashboard here. And what we do is we try to include 8 to 10 different nuggets of what we're learning from the data. And when we can, we'll highlight kind of where your answer sits compared with everyone else. We just added this ability to show you the trend over time of responses to some of the impact scale questions, which I think is really interesting. And of course, we'll try to change this multiple times a year to keep it fresh. Okay, this is our quarterly newsletter. So we put this together 4 times a year. And what we do is we include some details of what we're learning. We talk about the impact of the data we're collecting. We will share things that are upcoming, new modules. Oh, this is hiding my screen. There we go, I'm back. We'll share successes, and then we'll also have a call to action to, like sign in and fill out your modules, or please share this with your family and see if they're interested in participating, that kind of thing. But we're really excited about this, and we hope you find it valuable. Okay, and so for anyone who's not registered for the registry, we hope that you'll think about signing up. I wanted to kind of walk you through what sign up looks like. So if you go to our registry homepage, which is pkdcure.org/registry, you can go here to the registry homepage on the portal. So first time to the registry, you click here to sign up. And there are 4 pages to fill out in order to complete registration. So we ask for your name, your email, and the password for your account. We ask you about your date of birth, your diagnosis, and also your relationship to the patient. This is if perhaps you're signing up on behalf of your child with ADPKD. We ask for some contact information. And this is the consent form. So it is pretty small and pretty long. So I recommend what you do is click on this download or print a copy. Take some time with it, read it, make sure you're comfortable with it. Feel free to ask us questions. And then once you're ready to agree, we'll have 5 checkboxes, and you can go ahead and register. And I will say that there is an important second step to do before you're officially enrolled, and that's to validate your email. So look out for an email from the portal. You'll click on a link to confirm that is your email, and then you can log in. Okay, I wanted to acknowledge the members of our advisory groups. These are made up of clinicians and researchers and patients and members of the foundation, and they meet quite regularly to make sure that we are keeping the best interest of the community in mind, that we're answering the best research questions, that we're making access to the de-identified data easy for researchers so that they can start using this to really create some great conclusions. And I just want to say thank you to all of them for making this possible. And then of course, the people who really make this possible are the participants. So thank you so much, everyone who has signed up, who has answered these questions. We literally could not do this without you. We would not have an annual report without you. So thank you so much. Here is the contact information for our team and myself, and also the website for our registry homepage. The homepage too has a section called Research Findings, where we share with you posters that we've shared at research conferences or the annual report. We also have some more information about each of the modules and what we'll be asking you in them. So please check it out. Feedback is always welcome.
Excellent. Thank you, Elise. That was a great presentation. And I'm going to the Q&A to see if there's any questions. Okay, I see one comment from one person who says it seems like a barrier to get TKV is insurance providers who often deny requests for MRI to measure TKV. Imaging center ends up doing ultrasounds to try to get TKV, but not all imaging centers understand the request or provide the TKV after the US. Both my nephrologist and I are frustrated by this. So that's one.
Yeah, that's a great point. You're right. It is unfair for us to put the blame solely on the nephrologist for not getting a TKV, because there are challenges. I agree. One of the great things about the questionnaire, we got that from the Healthcare Access, is that we collect data on the barriers, especially around insurance, and whether it's clinician referral or insurance, and understand what that looks like. And then we can advocate with the clinician community and the payer community. And, I didn't talk about this tonight, but we do have a new program launching in the fall. It's called our ADPKD Centers of Excellence. And one of the components of that program is to provide funding to put a patient navigator in as many PKD clinics as we can. And one of the roles for that navigator will be to help manage that process of how to convince an insurance company to cover an imaging procedure, et cetera. And, once someone's done it once, it's easier to do it a second time. And we don't want to just put that burden on the patient. So I'm hoping that will go a long way in reducing that barrier. And then what's neat is that once that program launches, we can look at that data again and see if the number is changing. And, we hope that it does. Thank you for that comment.
Okay, here's another question. It says, how do you plan to increase diversity of race and gender among participants?
Yeah, great question. We have a lot of strategies. Some of it is around communication. What kind of messages are we sharing about the registry? And some of it is about the audience. So the foundation recently launched a peer ambassador program with the goal of having ambassadors for the foundation go to different kinds of communities, diverse communities in urban and rural areas, and talk to people about PKD, about the resources we have at the foundation, and just make sure that people are aware of the resources we have, and then make sure that we have the right resources, listen to them, hear what they say they need. So there's a lot of projects going on to make sure that not only are we really thinking about our messaging, but that we're also listening to those we're talking to and seeing what we could do better. So wish us luck. We'll see how that goes. If you have any suggestions, please do reach out to me as well, or any experience working with diverse communities. Thank you.
Okay. Next question is, must you be American to participate in the registry?
Unfortunately, yes. Right now it's just in the United States. However, there are other ADPKD registries in different countries. They're all a little different. Some are more electronic health record facing, some have some patient reported outcomes. So please feel free to reach out to me and let me know where you are, and I'll see if I can connect you with one of those.
Next question. Thanks to the registry team for all of this important work. Can you tell us about the recent impact scale poster was received by clinicians, and also which issues were of greatest interest to them?
Absolutely, yeah, thank you so much. Well, I think, it was interesting. So the National Kidney Foundation meeting, it was not just ADPKD familiar nephrologists, it was other nephrologists. And we found that many were not aware that that scale existed. So they were excited to know there was something that was validated in PKD, and they wanted to know how to use it if they could bring it into their practice. So it was great to spread awareness of that tool. I think the other thing that was remarked on the most was, that we brought that chart about the different kinds of pain and how it differs by stage. And I think there's a lot of assumptions that the more progressed your disease gets, the more pain you may experience, and we didn't necessarily see that. But we had a much large number of people in stage 3 or 4 fill this out than those in stage 5. So we just need some more data to understand, but there are some assumptions they make, and we could flip that around and say that clinicians assume that those earlier in disease aren't going to have pain, and we know that's not true. So I think it was really enlightening for them to see that pain is reported in all stages of the disease by many people. And so that was really great to get that validation of that data.
Okay.
Is that the full question, Melanie? Did I answer it?
Yes.
Okay.
Yes. Which did you answer? Which issues were of greatest interest to them? You answered
Yes.
that. That was fun. Okay. All right. Next question. How can someone sign up as a peer ambassador?
Oh, great question. Yes. We have something on our website, I believe. Perhaps we can send out the link with our post-webinar email. It's a great program. We would love to tell you more about it. You can also email me directly if you like, and I will give you the information. But it's we're looking forward to seeing how successful that is, and we'd love to have more people sign up.
Okay. The next, it's not really a question, it's more of a comment. It said, thank you for explaining the purpose for the repeated questionnaire modules. So that's the comment for that.
Yeah, no, thank you. I just want to take a comment on that, Melanie, really quickly. So, what I didn't talk about here is some of our future plans for the program. So we are working on kind of upgrading our registry to a different portal, still by the same vendor. We really trust them to keep the data confidential and private. But we're making some changes based on feedback we've received. And one thing we're doing is adding an autofill feature. So if you've already filled out a module, then when you get it the next time, then you'll have all of your pre-answers filled, and you can just change what has changed since the last time. So we're hoping that that'll make it a little easier and a little less burdensome, so you don't have to fill out that same question every time about when you were diagnosed. But yeah, thank you for the comment, and we'll continue to try to improve that for you.
Okay, the next question is, I've known about PKD for years, PKDF for years, but my doctors have never mentioned its existence to me. Why don't they provide this resource to patients? It would be so helpful to patients seeking research options, and also help with increasing the registry.
Yeah, we agree. I'm sorry to hear that your doctors didn't share this with you. That's I think one of the things that we hope to get out of going to nephrology conferences, and just being present and letting people know that we exist, because we want to be a resource for patients. And so, we do our best to spread awareness in the clinician community. I think that our new Centers of Excellence program that I mentioned, launching in the fall, we have a grant opportunity for clinicians to apply to, which will allow them to do outreach to both patients and other clinicians, to spread awareness of the disease and of the resources available. So I'm hoping that we can, help address some of those issues. We're not entirely sure what they are or why a clinician wouldn't refer someone to the foundation, but it might just be an awareness issue. So look to that. We're hoping to see some interesting ideas from clinicians about how to do that, and especially outreach to primary care, who don't know when to refer someone to a kidney specialist.
Another question. I've noticed several dietitians who are now using social media to encourage building clientele. Do you have any recommendations on how to navigate, who to consider working with and who not to?
Sure, great question. Yeah, if possible, to make sure that you are talking to your nephrologist and getting their recommendation or their referral is probably the best thing to do for your individual case. We do our best to share updates on the latest research of nutrition and PKD, recommendations at different disease stages. But really it just comes down to trusting your doctor to refer you to the right person. But yeah, if you have any questions about that, we have our PKD Connect resource is really fantastic, a great place to ask questions. And we also have a peer mentor program where you can talk to patients who may have been through this before and might have some tips for what worked for them.
And the next, it's more of a comment. Basically, the person says, patients can educate clinicians too.
Absolutely. Yes, thank you. Yes, we rely really heavily on patients to advocate for better care with their clinicians, and we just want to help, but yes, absolutely. And any tools that we can give you to help do that, we definitely want to, to send you there with everything you need to advocate with your doctor. So absolutely agree. And again, if there's any way that we can help, please let us know.
All right, I don't see any other questions, but feel free to submit any other questions you have.
Yeah, and also please feel free to email me or call. I'm always happy to talk about this with you. So and do check out our annual report. We'll be sending it out digitally, and there's also an option to request a paper copy that will mail to you. And it is also available in Spanish. And before we close out, I just wanted to do one more slide, which is to ask you to please fill out our survey. So we'll just ask you what you thought, give any other comments, maybe you didn't come to mind live, but you think about later. All feedback is welcome, and any other suggestions for topics as well. We're always looking for new opportunities to bring things in front of our community. So if you have time, please go ahead and fill out that survey for us.
Okay. And one more question just came in. It says, they said, what can you give me? I'm seeing my doctor in 2 weeks.
Send me an email. Let's talk. I'd love to hear more about your situation.
All right. Are there any other questions? If not, oh, the person said, okay, will do.
Excellent. I look forward to it.
All right. Well, if there are no other questions, we'll go ahead and conclude this webinar. Again, Elise, thank you so much. As always, you always have very valuable information and content. And again, everyone, a reminder, tonight's webinar is being recorded and it will be available on the PKDF website in the next week. Thank you everyone for joining PKD Foundation, and we will see you next time.